I am glad today to be seated with the Korle Bu Teaching Hospital's Chief Executive Officer, Dr. Opoku Ware Ampomah, to get to know the insights, the challenges, the good and the bad regarding the facility and how all these issues can be controlled. And now talk just a little around the morgues, because the biggest one, we have been told, we've seen pictures that it's in a deteriorating state. When was the last time you went there and what did you see?
I go there last week. I was there. The fact that the morgue is not necessarily in a deteriorating state, and so you need to also understand this.
Right.
So there, I'm saying that very few reporters come and actually dig back, and I'm sorry, but it's a reflection on the way our society is going, where we just want to get a sound bite, just something that is sensational, and then we don't care what impact, what effect it has. Okay, and so you end up damaging the reputation of an institution, which has people who have been working consistently, making sure that they are delivering at the best of their ability for the people under challenging circumstances.
Right.
And so now let's come back to the morgue. Now this morgue, for instance, we have 3 sections of the morgue.
Right.
Now all the 3 phases are working. There's not been any issue. There's no issue with them.
Right.
And they don't have any issue recently. Okay. But then what most people don't know is that if you go anywhere in the world, okay, most cities have got a city morgue. Okay. Now this city morgue is a morgue where if you find an abandoned body, hit and run victim, murder victim, or there's a forensic investigation, they have to exhume a body. Right. That's where those bodies will be sent. Okay. Now we don't have a city morgue in Accra. Okay. So Korle Bu Teaching Hospital morgue has become the default morgue. Okay. So you always see hundreds of cases brought in. Now if Korle Bu decides that look, these are not our cases, so we turn the bodies away, what will happen? Right. You see the kind of outcry that will be in society. But then we are storing all these bodies. Nobody pays Korle Bu Teaching Hospital for storing these bodies. Right. No, we have to pay electricity bills at the end of the month. And then so we store them. And then even sometimes occasionally, after a certain time has elapsed, we ask for the relatives to come and identify. If we don't get it, then those bodies will have to be taken care of, in the sense that we have to offer burial for them. So we do a mass burial for them, and then although this is not our primary, so we have to now go and pay the city authorities whose responsibility it was in the first place to take care of these such cases, to bury the bodies. But we've been doing this quietly. Right. Our pathologists, they work on these bodies. Okay. Now, do you know how much a pathologist, the fee for a pathologist, consultant pathologist, to perform a post-mortem on any of these abandoned bodies? No, how much is it? 5 Ghana cedis. It's 5 Ghana cedis, and that 5 Ghana cedis doesn't even get paid. So this is it. And so if you come to our mortuary, there are 3 sections of the morgue. Okay. So there's one section where we keep a lot of these abandoned bodies, and so that place usually has it because these bodies come in an advanced state of decomposition. So of course we can't control the state in which they came. So they come in, and so then it gives the morgue a certain kind of smell. Right. So people think that Korle Bu morgue is not a good place, but it's not. It's out of our control. Right. But if we were just keeping the regular bodies that come from the wards, which are fresh cadavers, then it will be as good as any of the private morgues around. But we also understand our place in that, not because of the kind of society in the environment we also have a responsibility to help meet the needs of the society. So we are providing this service on the quiet, and nobody said about it.
So looking at the place now that is serving as a city morgue, are there plans to renovate the place? Because you go there, waters are stagnant in there, flies hovering all around. Do you have plans to address that issue?
Yes, so there's a general drainage issue in that area. Right. There's a general drainage issue. So we've engaged the African Development. We've requested for a grant. So the African Development Bank is coming on board with a grant to actually redo the sewage and drainage system for the whole of Korle Bu. Because since Korle Bu was built over 100 years ago, no major rehabilitation or refurbishment have been done of this thing. So of course, a 100-year-old most of them like asbestos pipes. Some of them have caved in at certain points, and so we need to redo the whole thing. And so that project is going to come on. So they are in the final stage of the preparation for the project to come on. The Ministry of Sanitation, we are grateful to them for for coming on board. The Ministry of Finance to support our request to have this project done. And then we also are undertaking a project. There's a project that is actually one of the meetings I've had today, where we are finalized to do a new morgue for Korle Bu.
Okay.
So there's a new morgue going to happen for Korle Bu. That will be both a morgue and then have facilities for burial service and then like funeral home facilities. So like a one-stop shop kind of. So that project is also being planned.
Do you have timelines for that project?
Yes. So actually we are in the final stage of the approval. So we went to Ministry of Finance. They did their, but it came back and needed to get a transaction advice and a report, feasibility report. So that is being almost completed. And so to go back to finance for the final approval, then the project can take off. But in terms of the financiers and the funders, the funds are ready for the project to take off as soon as the requisite approvals are done. And so we are looking forward to that project. But then our plan also is that once that project takes off, we do not want to move to that new place with the old problems.
Right.
And so the proposal is that we are going to hand over the old morgue to the city authorities to come and take over and run it, so that becomes the city morgue. So that if there's any abandoned body anywhere in Accra, that body will be brought there.
Right.
Our pathologists will provide support, but then we don't want to be responsible. It's something that we think that a city like Accra needs, because if you go to every major city in the world, there's a city morgue, which so that both the police, the city authorities are the ones who kind of oversee that place. And so so that is the plan.
Do you have problems with digesters as well?
In terms of, so it's part of the whole sewage, environmental sewage disposal thing that we talk about. That way we've sought for support from African Development Bank to come on board, because we're looking at the entire chain of waste disposal, environmental sanitation, from both sewage to solid waste to clinical waste, everything. So that's a comprehensive project.
Because we've been told the wastewater is channeled into the Korle Lagoon.
Okay, so that's the main drain that serves this area. So of course, so that is what we are trying to, so that that waste, we want to make sure that everything is properly treated. But at the moment we can't be sure of the what do you call it. But we've been engaging the environmental EPC and other agents and AMA as well, to make sure that things don't go out of hand. But then there's also a challenge where when it rains and it floods, the waters in the Korle Lagoon, they kind of back up into the morgue, into the morgue area. So all that drainage systems have to be revised because of there's a road between there's a road across between the morgue and then there's a composting plant and then the Korle Lagoon. So all that has been considered as part of this this project.
But channeling the human wastewater straight into
no, it's not channeling human wastewater. No, that's not what I said.
No, I am asking a question. If the water is going straight into the lagoon, is that
because if the water in your gutters, it runs, you don't. But for the clinical areas, they treat it before it comes out. So that's what is done.
Okay. So
but then we think that we need to modernize the system, right? So that we don't introduce unnecessary chemicals into the environment. So we want to make sure that we have a proper treatment plan that treats it comprehensively and all the testing, etc. So what we want to do is to improve upon what is existing, because it hasn't seen any major rehabilitation in the last several decades, and so that is what we are going to do.
Last words from you before we wrap up.
So I'd like to thank you for this opportunity to stay outside of the story. I hope that you don't edit it so that the things that I said they will lose their meaning, because we've had that happen many times. Right. But then we also, I want to appeal to all Ghanaians that the Korle Bu Teaching Hospital is an important national institution. It's one of the institutions that we should all be proud of, because this is the foremost healthcare delivery institution, which is delivering quality, excellent healthcare, to all and sundry. We do not discriminate whoever comes in. We try to do our best for every patient that walks in the door. And it is our collective interest to make sure that this hospital is resourced and encouraged to be able to, provide the best of healthcare to everybody who all in Sunday.
Right. Dr. Opoku Ware Ampomah is the Chief Executive Officer for the Korle Bu Teaching Hospital. One of the key highlights that I am actually looking out for is the renovation of the morgue, to get to see how the outcome would be. We didn't have timelines as he indicated, but we are definitely looking out for that and hoping that it will all end in a very good manner. Thank you so much, sir, for speaking to us.